Kia ora tātou. Thank you all so much for joining us today for our walkthrough of what's new in Medtech Evolution version 8.3. I'm Liz Agnew and I'm Medtech's product manager for New Zealand. And with me, I also have Chrissy Patterson, our GM of product and delivery. Now, before we begin, just a little bit of quick housekeeping. We are recording this session, so we will share it afterwards. And if you have any questions as we go through the demonstration, we've got a questions and answers button at the top of the screen. And when you click on that, you should find a ask a question button, which is under a little speech bubble. So if you type in your questions in there, and we'll pick them up at the end after the walkthrough, which should take us about 45 minutes. And just so that you're aware, we have got the full release notes on our customer portal insight, so that you can have a look at those at the end. Just while I'm talking about the release notes, we have given them a bit of a glow up, so they should be easier for you to navigate through them. We've got some color coding so that you know whether the feature is new or enhancement or a change. We've got the effort that's involved for setting up a new feature if that is required, and also step-by-step guide on how to do that configuration, usually involving the role-based access control and other prerequisites. And we've also added pictures so that you can see what's new, whether it's been renamed or moved. And at the very end, we also have some troubleshooting, so some common issues and how to go about resolving those. Okay, so version 8.3 was released in May, and it includes 61 new features and enhancements, and they cover 24 areas of evolution. And as I mentioned, you may have to do a little bit of configuring before you can use those features. The role-based access control may need to be switched on before staff can use them, but we'll point those out as we go. Okay, so the items that we're going to be covering today, we're looking at 8 different areas. So starting with medications and prescribing, then looking at consultations and daily record, the inbox, the outbox, recalls and screening, appointments and queue, email, and then finishing with some admin. Okay, so I'm going to bring up Evolution now, and we'll walk through a number of these features. Okay, so starting off with, you'll notice at the palette at the top of the screen, we have separated the address and phone numbers to make it easier to see. So for those long phone numbers up the top there, that should be helpful to you. So starting with, we've now introduced an option for a one-time pharmacy. So in the RX pickup method, our little capsule here, we go in here, you see this new field here for a one-time pharmacy. So the benefit of using this is that it doesn't interfere with the patient's standard pharmacy, maybe that they're away on holiday or some other area that is not their usual pharmacy, so they want something sent to that other one. So you can go in here and find the one you're looking for and put that in there, and select the medication you want to prescribe. And generate and send, and that will send to the one-time pharmacy. Or if you look on the patient medication list, notice we've got a couple of new columns here. So we've got one here called top-up medication, and this allows a prescriber to prescribe a short-term top-up of an out-of-sync medication so that it aligns with the patient's other long-term medications. So, for example, if you have a patient who's lost or damaged the medication, or perhaps they need an early repeat because a specialist adjusted a dose outside your usual normal review period, so the patient needs a little bit additional to get them up to that next point. So what you would do is you would take that long-term medication, and we've got this new button on the toolbar there called Top Up Selected Medication. You can click on that and it will open up the medication so that you can change the period. And if we then OK that, that will add that to our list, our day's consultation. And notice in the list here, it's not replaced our usual long-term medication. It's just added it with the date and put a T beside it. So that when you next come along to do your full repeat of long terms, you can easily tick your all long-term medications button and repeat. We also have a column here called EXT for external. So any medication that's been prescribed externally, you can now more easily identify those. And when they're added, they have the provider as EXT. So if I open this one up here, and it will show here as the provider EXT, and here's our prescribed externally tick box. Okay, while I'm in here, you notice that when I've opened up an existing medication, it's brought up this dispensing pane. This used to be a tab that was at the back here. We've now made that easier to find so that when you hit a new, this column here, this pane allows you to expand and find the additional, add additional information. So if you're wanting to put in some comments for the pharmacist, you can put those in here. You can add in the reason that it's been prescribed and these other options here. So if you wanted to be reminded if the drug hadn't been dispensed, you could tick that box there. So that dispensing area is just been moved to the side there so that it can be more easily displayed. We also have another pane that can be used, which is if you have the administered in clinic turned on. We've also moved this so that it's now in another pane here so that you can record if you administer something in clinic. For example, if I put in some Depo-Provera, so I put in here injection, etc., batch number, expiry, and who also administered. So that is an additional area there that makes it easier to find. And once that's been put through, then you can see that in this admin column here. Okay. We've now adjusted, we've added a check on prescribing when you generate a script, when you're if you are using another person's name to generate a prescription, whether it's a registered prescriber or otherwise, that actually constitutes as prescription fraud. So in New Zealand, this carries serious consequences under the Crimes Act 1961, including potential charges of forgery and obtaining by deception, in addition to breaching the Medicines Act 1981. So we've added in a check so that when the generate button is clicked, it checks that the person who is logged in is the same person as the person that's going to be actually displaying on the script. So if I pull up patient. Barney Smith, he needs an urgent repeat. Now, this script here has actually been prepared for Jackie Dawson to sign. Unfortunately, Jackie's not in today, but they've asked Ian if he would generate the script and sign it. So if I hit this generate script button, I now get this message saying that the prescriber who's on the script is Jackie Dawson and differs from the user logged in, Ian Bishop. So it's now asking if I'd like to generate the entire script in Ian Bishop's name. And so if I say yes to that, that will then go through and put Ian's name on the script. So that ensures that you've got the right prescriber. So very useful if people are needing things urgently, or someone's been sent a task to do someone else's script list, etc. Okay. When you send one of your NZDPS scripts, we've now added in under the message transfer area a date time stamp for when the script has actually been sent. So up under your tools menu under messages lodged, you've got here a number of tabs. And so a bit similar to this RSD tab where you've got the date lodged and then the date sent. Under NZEPS, you will have the date lodged, and you also will see the date sent, which should be only a couple of seconds different. So that's where you would go to see that things have sent, where they've sent to, using that HPI mailbox. And the last thing about scripts is that you'll be pleased to know that with the 12-month prescriptions, we've removed the 3 and 6 month prompts that were previously in place. Okay. If you've ever wanted to change the consultation template that you have here, the ability to do that has been provided, which requires a little bit of setup first. The first thing is that you need to be given access to edit the notes. So this is under the staff member setup. There is a clinical tab, which has all of the formatting here, and you can put in headings and or any sort of template you want in here. And this tick box here needs to be ticked, user can change format. And then you need to ensure that the role has access to that area in the user preferences setup. So if I go to role and bring up my GP, and under user preferences, I have here a clinical area. So this will be starting on the left-hand side. You need to tick it and add it to the right-hand side. So that then when you go to user preferences, I now have a clinical tab, and here I can go in and change my font, change the size, change the color, put in headings and things that I want in this area. The other thing that we can do while we're in a consultation is we can now add an existing classification to that consultation. Using our right-click option, I now have existing classification here. So it will then give me a list of the patient's classifications, and I can put in whatever the consultation might be about. And that will then help us to pull out relevant consultations if I wanted to do a referral, useful for reporting and that sort of thing. And you can also, if you wanted to, make it mandatory for a classification to get added to a consultation. This has been available previously. It's under the location settings, but it previously was available via affiliation only. We've now expanded that to allow that to be mandatory by role as well. So if you wanted to have certain roles that you required them to put in a classification at the time of consultation, you can tick what staff members you want and add them to the area here and save that. And that would then allow you to, will then prompt the staff to fill out that classification per consultation. Let me just... for long consultations, I'll go back to my previous patient. Now, if you are viewing your screen with your sidebars and you are scrolling down here looking at previous consultations, consultations are now tended to get quite long. I'm not sure if that's due to the introduction of AI, but we've now introduced another scroll bar within the notes so that if you do have a very long note, you can scroll through it without the cursor jumping to the next part. So click in and you've got that second scroll bar, which should help view that note without having to open it up and scroll through it in your in your consultation screen on the left. Okay, moving on to the provider inbox. So the provider inbox, we have added in the ability to multi-file records. So this bulk filing is does require some role-based access control to be set up. So under our access privileges and role, we have a look under our GP, under the home option and inbox, there is a file multiple inbox records option. So this will be on the left-hand side. Tick it and add it to the right-hand side for the roles that you want to give this functionality to. So it may be that you have students or registrars or junior staff that you might not want to give that feature to. So you can have that turned off for them. When it's turned on, you need to have your auto preview in place. So your auto preview allows you to view an item when you've got it highlighted. The ability to then bulk file, this button here becomes available. And if I tick a number of things, so if I want some items filed, I can tick them and then go up to multi-file or multi-file with comment. If I choose multi-file with comment, I can enter a comment and hit multi-file, and those items will then file. And if I have made a mistake, I still do have my undo button, which will undo those filed items, but be aware it only does the last action that you did. So be careful with that one. You can also take these buttons and add them to your quick access toolbar so that they're a one-click item, so they're up the top. Now be aware that there are certain record types that can't be multi-filed, where the patient is not matched. For example, this one here, if I tick a couple of items there and choose to multi-file, it will come up with a message saying that it can't file. So items that are not matched or items that need further action like a GP to GP or a prescription approval, online forms, items like that. See your release notes for more information on those. Notice that our filter button here is highlighted to show that we have got a filter in place. So we're looking at things that are attention to Ian and a date range. So we've got that filter button highlighted in enough screens throughout Evolution to show that there is a filter in place. We also, for practices that have multiple locations, we have a number of, we have the ability to filter by location. So under your user preferences, in the settings tab, we've got an option here to enable provider filtering by multiple locations. When that is turned on, and I'll just do a quick log out, log back in. It then gives me the ability to choose the location. So in this filter here, I could say I only want to look at staff members from ABC Health, and then I can choose someone from this list here, which will be narrowed instead of looking at all the location staff. And that location filter is in a number of other places. For example, your patient search. You can also now, because I've turned that on, the user preferences filter by location on that screen as well. There's a number of others. For patients inbox, we've added a new feature that allows you to highlight important items. So you may have a lot of messages in here, and this one at the bottom is something that you want to flag as important. This little button here with a red thumbtack, if I click that, it will pin that item at the top there. Now that's for the whole practice, so be aware of those. And you can order the columns by the header as you can throughout the system. We've done the same for the Outbox. So again, you can pin certain items if you are wanting them to be not flagged as important. It's a toggle, so you can tip them and then hit the important or not important button to take that flag off. Tick, and then it will pin it to the top of the list. We've also added digital signatures. So again, this needs to be turned on using the access privileges and the role-based access control, and it is in the user preferences area. We have a documents tab. So you can see digital signature there. While we're in here, we've also got quick SMS documents and quick Outbox documents, which I'll look at in a minute. So arrow that from the left and add it to the right. So, whoops, sorry, under the user preferences and documents, this area here is where your digital signature can be loaded, and it can be in any of these formats, JPEG, PNG, and TIFF. So if you create your signature and you go select it and find the file, and that will then add it to here. And there is a size limit as well. And we've also got some proxy signature text. So if you are signing on behalf of the practice or on behalf of another staff member, this is the default message that will appear below your signature. So that would be if you are not the provider of the document. So I'm logged in as Ian, and if I do a off-work certificate, for example, I hit my quick access document button there, and it brings up my my template. I can move here, and I can then right click and choose insert signature, and that will put in my picture there, which I can then print or send via email. If I was sending an item on behalf of the practice or on behalf of another staff member, I'll just log in as an admin staff. And I was doing a new document. And the provider here is Ian Bishop. If I was wanting to sign on behalf of, I could move my cursor to here and go insert signature, and it's put in my signature, my name, and signed on behalf of. If you are not the same, if your login code is not the same as the provider code, then you will be a proxy signature. And you'll have noticed that the quick Outbox documents, we've now changed the icons so that they are blue circles, and we now have the ability to have 10 of those. And with SMS, we also have, they've been changed to red, and we have 10 of those as well. So for the practice, those are set up under reference numbers. So you can have 10 documents for the whole practice to use and 10 SMS documents to be used as well. If you would like to not use these and have your own personal set, you can now do that as well. I showed you the role-based access, but under user preferences, having turned that on, under documents here, I've now got 10 of my own. When you first start up, you'll get the default set that the whole practice has, and then you can go and change them. Once you've changed them, they will use what you select here. And you can create, add those to your quick access toolbar very easily by right-clicking and adding, and then they will appear up there so they're easier to access. Under recalls and screening, we have a new recall action status. So this allows staff to make a note of where in the recall process a patient is. So if I look at this patient's recalls, I can see that they've got a number of recalls outstanding or due in the future. If I open up one of these, I've now got this column here that says status. A bit of setup is involved first to get this list here, so you can tap to your needs, and that's under options, recall screening, and recall action status. So from here, if I wanted to add in one called new, so for example, I want to put in a new one to note that it's a new recall, I can add that in there, log off, log back in, and then I can add that to that particular recall, or when I have a new one, I'll put it in here and add that at the same here. Okay. Can also be viewed from the recall contact list. So if I bring up ones that are due, then you can see here patients have had like a first contact or a text message has been sent. So it just gives a little bit more information. And you can also click on that header, column header, to order the list of patients by the recall action status. The other area that we've adjusted in recall screening is the outcomes for a screening. So we go to options and recall screening and then screening term. Often you may have a large number of outcomes, and when you go to find one, they're not in an order of the most commonly used. For example, for your cervical smear, if you're wanting normal to be at the top of the list, you've now got these up and down arrows that allow you to adjust the order of the outcome. So it may be that you have normal or HPV negative at the top, and so on. So this allows you to adjust to suit your practice, your practice needs. So once that's done, then when you're putting in screening, that list will then adjust after you've logged in and logged out again. And that will be shown here. Okay. Moving into the appointments area. So we've adjusted the appointment pad so that it allows up to 20 providers. So if you've got your appointment pad open, the appointment pad allows you to have all the providers listed for the day, and you get to choose the width of the different columns and what displays. So here I have an appointment pad. If I need to adjust that, if I go up into options and appointment and then template, pad layout, and I can open up one of my previous pad layouts, and that will then display all 20 spaces where I can add some more providers. Down the bottom here is where you get to select your column widths, and you've also got an option there to not display the provider if they don't have a template for that day. We've also updated the audit tab so that you can view if anyone has made changes, and that's also printable. For the appointment book, I mentioned previously that we had the ability to put in, enable the provider filtering, and which I did with Ian. So I should. And that means when you're in the appointment book, you can filter to just view providers from that particular location. So you now would have this ability here to select this specific location, and then that would narrow this list here to just those providers. For the queue flow, we have added the ability to auto open the queue workflow when you log in. So this can be done either from the staff member setup, or you've also got the configure user workspace area. So under configure workspace, you have your two workspaces, your user workspace, which is your second screen, which you may want to tick your workflow here, or you've got your main workspace, which is what we're in at the moment, where you could have that automatically open, or any of these other 5 items. You just can't have the book and the pad open at the same time. And you've also got your ability to auto open when your first patient is selected on your main workspace. So for those of you who aren't familiar with your second screen, that's your open user workspace there, and that will open another screen to allow you to have more real estate. we go to the queue, you have your usual 6 different queues. We've added here a button to allow you to quickly add a new offline queue appointment. This could be used for the likes of a phone call or a video consult, and you can see that it's marked as grey, and so then it differentiates it from the people who are walk-ins. We've also added a ability to adjust this layout. So we've got this new filter button here, and it gives you the ability to filter by certain staff if you only want to see certain staff members, and you can also filter via these other fields. But the main, the biggest change would be this bottom section is to choose what you want to view. So if you are not concerned about the arrivals and departures, and you're just looking at the patients that are either awaiting triage, in triage, awaiting consult, or in consult, would select that, so you only have 4 of the 6 queues displayed. You can move these around, so if you wanted the triage in a line, you can move them around. So if I put want triage on one side and consultation in the other, then I could do it that way. If I wanted to, I could have one highlighted square, and then the other 3 would be down the bottom there. So that's through your filter, and that will remember your setting for when you next come in. We've also added the ability to just view patients that are waiting for you or being seen by you, and that's this little button here, so that will click to show only my patients. So if I hit that, then I only see the patients that are for Ian, as that's who I'm logged in as. Okay, moving on to email. Now, Microsoft is going to be deprecating the support for the basic SMTP authentication. This stage looking like it's December 2026. And so we've introduced a new advanced SMTP configuration using SMTP to go. And so in our location settings, we've got a tab in here called Web Forms, and here is where, if you're using SMTP, it will be set to be basic. So in here, if you wanted to use our SMTP to go, you would select advanced, put in the display name that you want to show on your emails. So that would be, whatever your medical centre name is, and then you can choose what you want the email address to be at medtechoncloud.com. And then you've got a reply to email address that will not be displayed, but it will be where if the email's replied to, where they would go to. Once you fill that in, you hit OK to save it, and then after you've saved it, hit the Retrieve API key button. That will then automatically, it will give you a little message, and you can then send a test email. Here's one that I prepared earlier. So ABC Medical and to me, so test email to show that it's up and running. And then you can OK that to save it. Then when you're sending out any of your invoices, documents, etc., they will all go through via that email address. Be aware that we have updated all the system-generated patient email subject lines. We've standardized them to remove out any identifiable information. So subject lines now use a generic action-oriented language and all those sensitive details contained within the body of the email or the attachment rather than in that subject line. So if you want more details of that, have a look at the release notes. Okay, moving on to admin, a bit of admin. If you are inactivating a provider, we've now put in a little message to advise if any tasks or inbox items or patients are still associated with that provider. So if I open up this doctor here and tick inactive and click OK, I'll get a little message. So we've got number of patients still registered, some recalls, unfiled inbox records, and some incomplete patient tasks. It asks you if you want to use the bulk provider update utility to update these. So you can say yes to that, it will automatically bring it up, or no, it will just inactivate the patient, or if you hit cancel, that will then take you back to the screen. I'm just going to cancel out of there, and I'll take you to show you where the bulk provider update utility is, and that's under the tools menu. So you choose who the old doctor code is, who you're moving them to, and then you can choose what items it is that you want to update. So if all the patients are going to the new provider, you can select that, and they're getting all the recalls, tasks. Note that's patient tasks, not ones where a patient is not associated. Unfiled inbox records, and at the same time you also have the ability to update that inbox to field that's in the staff member, so that any future emails that any future messages that come into the inbox that are addressed to the old doctor will then get rerouted to the new provider. The update unfiled inbox will give you the items that have already been sent that have not yet been filed. Note that this is only going to be processing any active patients, and we would recommend that this is run outside of your usual business hours, because it may take a while, and it means that it will ensure that all your patient records are successfully updated. We also would caution you to ensure that only staff that are authorised to have that ability to do that, like a patient join, it can't be undone. So make sure that's used very carefully. Okay, so that is going through all of our 8 areas. We are now up to the question time. So I'm going to bring on Chrissy Patterson, who hopefully during the time that I've been talking, there might have been a few things have come through.
All right. So what I'm going to start with first is there are a few queries that came up in the chat facility while Liz was going through. So I just want to cover those off so everyone has visibility of those. So the release notes for version 8.3 and version 9, for which we are doing a webinar tomorrow, are already on Insight Customer Portal. So you can just log in there using your access that you already have, and in the Evolution download section you'll find both the version 8.3 and version 9 release notes that you can download and review, and that will cover off everything for today's webinar in those release notes, and obviously tomorrow's one in the version 9 release notes. This webinar has been recorded, so it will be made available on YouTube later today, and we will be sending a link to all registrations, anyone that signed up to this webinar, in case you have missed it or you would like to pass it on to other members of your team. And Medtech Cloud. So if you are on our Medtech Cloud, if you are on our public cloud, you will be upgraded over this weekend straight from version 8, which you are currently on, through to version 9. So everything that Liz has shown you today will be available on Monday morning for you as part of that version 9 release. And if you are on our Medtech private cloud, your upgrades have been scheduled over the next 2 to 3 weeks, and you will have received already or will be soon to receive a notification that will tell you when your outage period for your upgrade is. And if you are hosted by a third-party provider or are on-premise, you will need to arrange with your own IT provider to have your upgrade completed. So those are the 3 things that I wanted to start off with, Liz. Those came up a number of times in the chat,
Okay.
which I answered
Thanks
as
for
we
that
went, but I just wanted to
clarification.
raise them. So a few other questions for you, Liz, that
Mhm.
I will run through now. So one around the emailing subjects and the new subject lines.
Mhm.
The question is, can we still put our practice name or invoice date into patient emails, or are the new subject lines fixed?
So they are fixed and standardized. You can't configure them per practice. So it's a privacy-driven change to remove that identifiable information from anywhere it might be seen without authentication, like so a patient's locked phone screen or something like that. So that sort of gives you the reasons behind why we've done that. So yeah, if your patients have previously relied on that subject line to spot something specific, so you might need to, give them a bit of education on the subject, bit of briefing ahead of go live, and if this is something that you're wanting, something customized, then I'm going to pop up a little feedback here. If you want to scan that QR code with your phone, you could provide us some feedback and we can take that on board.
Right. In regards to the digital signature,
Mhm.
if somebody hasn't uploaded their signature yet, but the role-based access control for the digital signature has been enabled, will
Mm.
anything break when that happens?
No, so nothing's going to break. You'll still see, if you've been given role-based access, you should be able to see that documents tab. If you haven't got anything in there, then that right click where you've got the insert signature, that will be grayed out, so you won't be able to actually use that if you haven't got anything attached. Um, so yeah. Um, for that signature, just be aware that it only works for text formatted Outbox documents, not for Word.
Okay. All right. In terms of the quick Outbox documents and the new capability to have them at a user level, can the option for the quick Outbox documents be determined by role?
So for the quick Outbox documents, we've got the 2 options now. So you've got by practice, so that means everyone gets those ones, or by specific user. We haven't gone down the role route, but if that's a suggestion, if that's something you want, flick us a message through the QR code and we can add it to our list of requests.
Okay. If we mark a record as important in the inbox or outbox, do other users see that flag, or is it just for the person who set it?
I know those important flags are practice-wide. So if anyone else opens that patient's inbox or outbox, they will see those flagged, marked items at the top of the screen there. And it's a toggle, so you can either tick the item and turn it off, or leave it on. So yeah, it's available straight away, so it doesn't require any role-based access control. Yeah.
And I think you covered it, but we'll just go over it again quickly. If a
Mm.
patient has a preferred pharmacy already, does the one-time pharmacy change it after we send the script?
No, so that's the whole point behind the one-time pharmacy, is try not to disrupt your usual pharmacy for the patient. So it's yeah, it will just after that one send, after that it will return back to the preferred pharmacy that you've already got saved in that. As long as you've got that the save tick box ticked, that will go back to your preferred pharmacy.
Okay. Now, just having a look here. The consultation note format, a question has been asked around that. Can two users share the same consultation note format, or does each user have to configure their own?
So each user would configure their own under that user preferences clinical consultation notes area. We haven't got a share with the team option. But if you did want to have some standardization, then either give people not the access to change it themselves, and or yeah, give them a bit of a brief in training.
Okay. What do you recommend for a practice that has more than 20 providers but would like to use the appointment pad?
So we've got 20 on any single layout. So if you've got more than 20, then you're going to have to split them up. So you need multiple layouts. So I don't know, maybe if you're covering a couple of locations, you'd have them per site, or maybe by service line. So you could have all your nurses in one, or your doctors in another, or yeah. So your existing layouts are going to carry over. You just need to add in those additional providers to what you've got there.
Okay, so there was just another question raised in the chat around do you need to change the SMTP authentication right now, or wait until you're advised to? I've just basically written back to that and said that you can change it anytime you're ready to, but as long as it's before December at the end of this year.
Yeah.
But Liz, if you want to just show quickly again on the screen how to tell what you're currently using today, how you know whether you're using the existing basic SMTP configuration.
Yeah, sure. So up here under options, under Evo button options and location settings. And if I go to a different practice, one of my different locations, under web forms here, if you have SMTP turned on already, it would be sitting here with under basic, and that would be your usual host, port, username, password, etc. So that would be the old way, and then this new gives us the display name and the at medtechoncloud.com domain. So yeah, so when you upgrade to version 9 or 8.3, then yours would still be sitting at basic, so we wouldn't change anything there.
All those configurations carry over and are not touched, and you can change it to advanced when you're ready. The location filters, so you were showing some of those new location filters across some of those different modules. Do they remember what the last selection was, or are they reset every time you go in and out of those screens?
No, those are remembered. So here I am in the inbox. See, I've still got my filter on, and that will save once I exit out. And if I go back in, that is remembered.
Okay. And the bulk provider update utility that you covered in that admin section. So does that update records that are already assigned, or only new ones going forward?
So if you're talking about inbox items, so when you run it, it will take any inbox items that have not yet been filed and update them to the new provider. And only if the patient is active, and if the items, anything going forward that comes in after that, as long as you've got that update the inbox to field in the staff setup, that will take care of anything that arrives after the old provider has left. So it only acts on active or outstanding records. So all your historical filed records, they will stay attributed to the old provider, which is what you want for your auditing purposes. And yeah, so inactive doesn't touch anything inactive either, just those that are unfiled for your inbox and incomplete tasks that are related to a patient. It won't, anything that the old provider had that was just in their own name, it won't allocate those to the new provider. And yeah, still totally recommend that it's done out of hours, and it may take a bit of time, and you don't want patients to be open while it's occurring either.
Okay. Cool. So anyone who has read the version 8.3 release notes, you would have noticed that we haven't covered off everything in today's webinar. There's just, as Liz mentioned at the beginning, quite a lot of new functionality and a few little features here, there, and everywhere that we've added. So if you haven't yet read those version 8.3 release notes, please go ahead and download them from Insight and have a look through them. And yeah, you'll see some of the additional items around patient alerts, invoicing, patient search, and address book that we haven't covered in today's webinar. But I think we're at the end of time, Liz, so that's all of the questions that we have had available. But yeah.
Great. Thanks, Chrissy. And be aware that the majority of the changes that were in version 8.3 came from software improvement suggestions submitted by users such as yourself. So please use that QR code that I had displayed. Let me just pull it back up, and send us some your suggestions. And if you're coming along tomorrow, 12:30 for our version 9, I'll see you then. And yeah, thank you all for your time. We appreciate your interest and your questions and your feedback. So please take care, enjoy the rest of the short week, and happy Matariki. Ka kite anō.